Urinary tract infections or urine infections commonly seen in children. It is scary for parents. Now, what is a urine infection and how does it happen? Urine infection is infection that can happen in your child across the urinary tract. So it means at the point of producing urine, at the point of storing urine, which we call the cystitis, or anywhere along the kidney tracts, which is called pyelonephritis. So it's a different spectrum of infection. Majority of the times we see urine infections related to young children, and making a diagnosis is a real challenge. Now, what makes your child get a urinary tract infection? If it is a young child, especially boys, there may be a history in the antenatal scans itself. When the mother is pregnant, when she gets a ultrasound scan done, they may identify some kidney problems through the scan, and such children definitely will need follow-up. Usually you will see your neonatologist identifying this, doing some basic scans on your baby and following it up. If your child has had problems like these identified, it is important to get that follow-up done. And if they get fevers, it's important to check the urine. One thing I want to state as a caution is, with urinary tract infections, when your doctor examines the child, they may not be able to pick it up clinically because there may not be any signs. So only when we do the urine examination, we will be able to identify the urinary tract infection. Now, older children, they have a habit of holding on, especially when they're in the school. They tend to hold urine and not pass it on the right time. They may even hold their poop and not do their potty regularly. So children with constipation are at risk of urinary tract infection. Children who don't pass urine completely, they don't completely empty their bladder, they can tend to retain this little bit of urine which stays in the bladder and can get infected. So it is important, especially for school children, to remember to pass urine regularly and fully, and also have a routine for doing their potty regularly and to avoid constipation. Now, how do we identify that a child has got urinary tract infection? You may see that the child may have pain when they pass urine. They may either pass like small frequent amounts of urine, or they may go to the loo frequently and it's hurting every time they pass urine. And they may have fever with chills. So these are like the common symptoms of urinary tract infection. Sometimes just very high grade fever itself is enough, and they may not have all these associated symptoms, and these fever will not be responding to fever measures like what we regularly follow. So these children, when they are assessed in the hospital, we tend to do a clinical examination and then ask for a urine routine examination and a urine culture test. Now, urine routine, ideally, the way to collect the urine is a clean catch sample. Now, if you have an older child, they are very compliant and they are able to provide that clean catch sample. Sometimes it is not possible to collect that urine, and that can delay the diagnosis. So we tend to do something called a catheterized urine sample examination. Now, what does that catheterized urinary examination mean? It's about putting a small feeding tube into the urinary tract or the urinary passage and then collect that sample. Now, this is the most reliable urine sample to get a diagnosis as fast as possible. So we tend to send for urine routine examination, which usually comes within a couple of hours, and we look at the pus cells and the other components as well. When we do the urine culture, we actually tend to grow the bugs in the lab. So the result takes at least 2 to 3 days for us, but it will tell us what type of bug or bacteria has grown and to what this bacteria will respond to. So for example, what type of antibiotic it will respond to, so that we can tailor. We do more like precise medicines for the child rather than a broad spectrum. However, since it takes at least 2 to 3 days for us to get this culture result, we normally prescribe antibiotics, which is a broad spectrum one. That means we know what the commonest organisms are for the child, and then we tend to prescribe it and then we see the response. So a child with urinary tract infection needs to be managed in the hospital if it is a young infant, especially under 1 year. They may need IV antibiotics for at least a week to make sure that the urinary tract infection is completely treated. Now, I have seen majority of the parents getting very scared of IV antibiotics, and I would like to reassure such parents that hitting hard is more important than a slow one. So we tend to take it very aggressively initially, and then once the child is symptom free, we tend to de-escalate to oral antibiotics. So I would reassure parents to not get worried so much, especially in the management of urinary tract infection. Why is it important to treat a urinary tract infection effectively the very first time? It's important because it can have long-term consequences. It can lead to your child getting high blood pressure. The child may have a poorly responding treatment if we have not done the right urinary cultures and sensitivity pattern and treated with the right antibiotic. A partially treated urinary tract infection can eventually lead to scarring in the kidneys, and that can lead to serious consequences as they grow up, which can include even as serious as kidney failure or renal failure. So it's important to prevent these complications upfront, and that is why we are very proactive in making a diagnosis. So making a diagnosis includes the correct way of collecting the urinary sample, making sure that we understand what bug grows, and to give the right antibiotic for the right duration. And so follow-up is very important for such children. Especially in the under 1 year age group, we tend to do, especially in the boys, we tend to do a test called MCUG, which is micturating cystourethrogram. We usually get our pediatric surgeons to have a look at that and do that test to see whether the urinary tract is appropriately formed, whether the flow of urine is correct, and so we can fix that problem if there is any issue. So we do need a multidisciplinary team approach, especially during the follow-up, which may include your pediatrician, a pediatric surgeon, and the radiology services that needs to be around. How can I make sure that my child doesn't get urinary tract infection? So if it is a young baby, make sure that the nappies are regularly changed. Ideally, we prefer not to use regular diapers. If you are using it, make sure that it is changed regularly. And wiping or cleaning the area is also equally important, especially for the girl children. Most of the urinary tract infections are due to gut-released organisms such as E. coli and Klebsiella. They are found in the child's potty. So what we need to do is make sure that that part is not contaminating the front of the child. So we always recommend wipe the bum from the front to back and not the other way. So it's very important, especially if your children are being cared for by the nannies. So it's important to be making sure that they understand how to do it properly. The next thing is in a school-going child, make sure that they have a regular routine and they pass the urine. We sometimes say it's double pass urine. That means you pass your urine and then you wait till the last few dribbles are out. So these are like some of the things, and make sure that your child is well hydrated. The summer is coming up now. It's important that you make sure that they take plenty of fluids regularly. At Aster RV Hospital, we give importance to children to make a quick diagnosis and precise treatment to the child for the right duration, and we have a multidisciplinary team to support and make sure that the child who has a simple urinary tract infection doesn't get any further complications.